Yes.
Hey everyone, I'm so excited to have you here tonight. I am thrilled and cannot wait to share these lovely ladies with you, which you all know, at least Laura too, because I've had her on podcast before. But I'll introduce them here shortly. We're going to give a few minutes for people to get on. If you don't even know what this is about, this is our live chat about happy handling, the workshop that we're going to do on January 29th from 9 to 2. The event is a full day of awesome information in regards to cooperative care and behavior, and also Q&A panel discussion as well with both Laura and Dr. Emmons. And we will also have lunch together. And it's pretty much to kind of give veterinary professionals, groomers, shelter workers, dog trainers, animal behaviorists, behavior consultants, and pet parents tips on how to prepare their dogs and be more confident for vet visits. So we're happy to have you here tonight. If you are coming in, please say hi to us below. I think it's below, maybe side, below, wherever it is.
Below.
Yes. And as we go through the chat, the live chat, feel free to leave some questions. Laura said she's going to monitor those, and we will get to those at the end of the live chat as well. So let us know that you're here. We would love to know. Well, welcome, Laura and Dr. Emmons. Do you want me to call you Dr. Emmons? Do you want me to call you Dr. Shannon or Shannon? What do you want me to call you?
You can just call me Shannon.
Perfect. I love it. Okay. That's easier for me. Great. Okay. Well, welcome, guys. How are you?
Good. How are you, Megan?
I'm good. Cheerful as ever, if you couldn't tell.
Yeah, I can see that. I'm starting to go down in energy. You seem to be like just nice and steady. I'm a morning person, and nighttime is like ready to zone out. But I'm here.
Bedtime is rapidly approaching.
Yes.
So.
I love it. And how are you, Shannon?
I am doing all right. Thank you.
You're doing good. She just came back from Florida, so she might have some, what do they call it, jet lag or something. So bear with her.
No jet lag. Just sad that I left 80 degrees to come home to 6 inches of snow. But that's my only complaint.
I bet I'd be right there with you. Okay, guys. Do you want one at a time while people keep kind of jumping on? Just tell us a little bit about you, what your business is, what you do, your background. Just kind of give us a little bit of snippet so everyone that doesn't know you by chance and your amazing experiences, that they have a little bit of an idea of who they're going to hear tonight and hopefully on Sunday in a week.
Shannon, you want to go first?
Sure. Dr. Shannon Emmons. I own Eliot Veterinary Hospital in Eliot, Maine, so a little bit further outside of where Laura and Megan live, but we are a small animal general practice. I have a special interest in veterinary behavior and will be starting residency soon. So not boarded yet, but taking the steps to get there and super excited about that. I really started to like behavior in vet school. We had a great professor, and the fact that we actually had a class on veterinary behavior was kind of rare for vet schools. So it piqued my interest, and the more, the longer I've been out in practice, the more I started to realize the need for more people who recognize veterinary behavior is important. So that's kind of how I get involved, and my practice, we've been evolving over the past few years, working on our handling in clinic, recognizing patient stress, and, really seeing the long-term results of how treating our patients well right from the get-go extends to them being happier in the clinic long-term.
Love it. Love it. Can you, before we jump to Laura, you had mentioned something that was interesting that I don't want to miss out on, and that was you were not really surprised, but the fact that there's not a behavior course taught in veterinary school a lot. Can you explain that a little bit for people that don't know? Because they probably assume there is, but there isn't, is what you're saying. It's not often, I should say.
Yeah, it's hard because in veterinary school we have 4 years, which sounds like a long time and is a super long time when you're in the thick of it, but you're learning so many species, and you're learning everything from anatomy to disease to nutrition to medicine to surgery and everything, that it's hard to give any one subject a full dedication. And, there were certain courses that really we didn't get a lot of attention in. And that's just because we certainly didn't have the time, or we didn't have the specialty available to help teach us. My veterinary school, Atlantic Veterinary College, actually now has a behaviorist on staff. So that's amazing. Not every veterinary school can say that. And so yeah, it's the exception to have that much information, to have a course dedicated to it. Otherwise, it's usually something that's kind of covered in our general practice kind of malady stuff, with ear infections or skin stuff, something that we learn a little bit about, stuff that we're going to see on a day-to-day basis. What do we do? But not necessarily a deeper dive into what's the difference between fear, reactivity, or aggression versus separation anxiety versus confinement anxiety, and kind of breaking behavior into the really complicated parts, not to mention all of the different meds and everything that goes into it. So, and that could be said for every veterinary specialty. I certainly didn't learn how to do back surgery in vet school. We stick to the basics. We'll save that like for the neurologists. But yeah, it's definitely something that I wish we had had more of in vet school. And I took the opportunity to get more of in vet school through electives. So there's always that option too, but it's part of the reason why us as vets, we really, a lot of us feel under-equipped to deal with it. So unless we're putting in the extra time and effort, it's something that we don't come out of vet school with a ton of knowledge.
Yeah, which I think is important for people to understand, because I think that they don't realize what's entailed in vet school and how much you do have to learn. And so I want people that are on this to understand not every vet comes out with every piece of information you could possibly know. Like, and I'll say of personal experience, I just lost Liberty and you were helpful with diagnosing her. And we had questions about genetics and you went right to go figure out, because you're like, I don't know. So let me talk to some people that are familiar with that. And I want people to understand that vets aren't going to know absolutely everything. They're going to do the best they can. However, based on what you said, you're getting absolutely everything possible thrown at you in a short amount of time. So I just want people to understand the pressure that you guys get under, even in the moment, because you're doing with what the best you got in the time that you have. So I think that was just important to share with everyone. So
yeah.
Sure. All right, Laura. Sorry, I didn't mean to jump in there. I just wanted to capitalize that a little bit.
Yeah. Oh, no, I think that was good. I forgot the original question, but I assume you want me to just kind of introduce myself.
Yeah, introduce yourself, your background, all that fun stuff. Yeah.
So for those of you guys who don't know me, Laura Gendron, and I own Misbehavior. And it was funny. I went to the New Hampshire SPCA I went to UNH to start with. Then I went to the New Hampshire SPCA to do an internship in the vet tech type stuff. So I actually started in vet tech. And then I kind of snuck my way into not snuck my way, but like I was one of just a couple people who went over to the behavior department to work with the trainer who was there at the time. And I just got completely hooked from there. So my behavior career started in the shelter, started at the New Hampshire SPCA. And I still have a very strong love for the shelter and rescue environment, I guess. But then I decided I would do sort of an internship, more of a shadowing, I guess, at a vet practice locally. And so I started shadowing, and then I got hooked to that too. So I couldn't decide what I wanted to do. So I was still really into behavior, and then I started shadowing at the vet's office. And then I decided that I would see if they would hire me at the vet's office part-time for behavior consulting or, whatever. And then I was there for 10 years. So needless to say, a lot has changed in my life since then. Like I started in group classes, and I did sort of the classic style of training. And then I had kids, so I had to cut back on some of my hours. And so I got into private training. And now I'm really into virtual training since COVID. I kind of jumped into that, but it sort of was already something I really wanted to do. So I do a lot of virtual consulting at this point, and creating courses and creating, workshops and classes and stuff like that virtually. But it has definitely given me that whole well-rounded look at as far as the vet stuff goes, at things from both perspectives. So seeing things from clients I talk to from their perspective, the pet parents, and then seeing things also from the pet professional perspective, and then seeing where things are kind of getting sticky. Like why is it so hard to communicate effectively as a pet professional with the clients who are really emotional. They're there with their dogs, and there's a lot of emotion that goes into, having your dog in a vet visit, which I will certainly be happy to talk about in a few minutes. I'm sure that will come up because that's in the back of my mind. But that's sort of like what got me into it. And then I really enjoy working cases and working with people and really getting to know each individual case. So it's kind of just been like, just a little of this and a little of that and a little of this, and that has brought me in. And then there's lots of other stuff in the background, but awesome. I won't bore you guys too much with all the little nitty gritty details. We'll save that for later.
I love it. So this kind of goes along with what we were just talking about. But is there anything else you want to add? And the fact of, I guess specifically behavior and cooperative care, like what interested you guys in that the most? I know you dabbled in it a little bit more, but do you want to add anything more? Do you want to capitalize on that a little bit more? Because you guys give us a broad view, but is there anything else you want to add to that? Why you have such a strong passion about it?
Yeah, I'll go first on this one. So I from personal experience, so Willow is my I guess we call her like the second generation dog of my own as an adult. So I had my first generation dogs, and then now I have Willow, who's my second generation dog.
I love that.
Yeah. And with a little bit of an overlap, but now we're fully into second generation. So things were done very differently with my first group of dogs, which I had 3 at the time, where there was a lot more get it done sort of attitude to it, even for me. Like even I would still try to do the best I could with what I knew at the time, the information I had at the time. But even back then, I'm talking just, she's 6, so 7 to 10 years ago or so, when I probably first started in the vet practice, there was a lot of like, well, we have to get the nails cut because the nails will keep growing, and we can't finish our like prep of getting the dog desensitized to the nail trimmers before the nails need to be cut again. So like, what do we do? And it got really, really hard. So there was a lot of like, well, we'll just get it done and then you can work on it. And so the cycle would sort of continue. And each of my other dogs had, of course, their own personalities. So I can't say that Willow's the same, but what I've noticed now is I've learned more and have done hopefully better is that, one of the top, I'll bring this up now because I do want to bring this up. One of the top issues I've had with her most recently is that she doesn't like restraint, like full body restraint. And if you guys at the workshop, I have found a really interesting, I was going to say cute, but like interesting. We'll go with that video that I'm going to share at the workshop. But of practicing some restraint with her, and you can really see it in her body language. And she's like, no, I'm not comfortable with this. And this was the video I found was about 3 or 4 years ago. And so now I've learned even more about how to do better with a restraint. She's back there tearing up a bed, just so you guys know. It's going to get really fluffy in here in a minute. So anyways, I had her probably, it's probably a year and a half ago now or so. She pulled something, she hurt herself somehow. She would yelp every so often when she would walk, but then she would, she'd still run and she'd still play and she'd still find her ball and she'd still want to do all of the stuff that she wanted to do. But she would keep yelping. And I was so stressed about the idea of taking her to the vet for more than just her vaccines or her regular physical stuff. To get x-rays on her, I was like, this is going to be completely traumatic for her. She's going to hate it. She's going to growl at everybody. All my hard work is going to be out the window. So I put it off for a good solid year. And I would say just within the past, like a couple months at this point, I more proactively actually got her treated and checked out, and we did full sedation exam. There was some growling at the very end as she was waking up. She's gotten acupuncture since then. There was some growling, but we've we've gotten her now into this pattern and these routines and she has gotten much, much better. And then I've worked with clients also, and I've really seen a huge difference with them too. So, so I just wanted to kind of come at that from like a personal experience level, because it took me that long to really get her treated and seen for this issue. And now she's already feeling much better, and she's only been treated for a couple months at this point. So
I love that.
So that's kind of part of my passion. Yeah.
She's showing off.
Yeah.
Stop telling my story, she's saying. Stop telling me.
It's going to start snowing in here soon.
Yes. If any of you that are watching, if you have a story like that, or if you have a fear like Laura had in the beginning, share it with us, because Laura can really relate to that. And she can probably give you some tips on like how she did her first step or what she did to kind of get to that point. I'm sure she'd love to share that. So if anyone feels that white coat syndrome, as I like to call it, with their dog, share below. We'd love to hear it. All right, Shannon, you want to share yours and kind of why you love this behavior and cooperative care stuff?
Yeah. I think my story is pretty similar to Laura's. Veterinary medicine definitely is changing, I think, for the better now in regards to how we handle our patients. But when I first started practicing, that's what we did. It was, you get it done and we're like, oh, haha, oh no, he peed himself or whatever. And like looking back on it, it's horrifying. And sometimes even with the best we do, we still have animals that are fearful, and we just have to say, all right, we need to take a step back and evaluate whether or not this is something that we really need to be doing right now. But with my own dog, he's going to be 6 in January. And when we first got him as a puppy, he had his first vet visit, not with me. But the first vet visit that was with me was traumatic. And I'm talking like 12-week-old puppy, flailing, alligator rolling, like trying to bite at us, like acting like we were murdering him. And I was like, holy cow, what is going on? So we started working on desensitization to veterinary visits. I found out that he really hates restraint too. So that was a really big part of it. And kind of learning how to advocate for him and work with him. I mean, now I draw blood by myself. I can trim nails by myself. I can do anal glands by myself. Like, he lets me do whatever I need to do with him. He's easy. He's the dog that if we need to teach someone to do stuff on, we can use Baxter, because he's learned over time that okay. And it's given me the ability to advocate for him too. Like when he has to go to specialist or emergency, because he's always trying to kill himself. I can be like, don't restrain him. Like, here's what you do. We've worked on it. You can do this, this, and this, and he'll be fine. So it's nice to know him that well. And I've got another dog now who also really hates restraint and anything done to him. So we're starting very slow with like working on just handling of feet. He's super head shy, so like touching his ears is still a really big deal. And of course he has recurrent ear infections. So it's nice to have that knowledge and then to see like how much of a difference it makes like in staff morale, how much happier my staff is to not be traumatizing animals on a day-to-day basis, and how rewarding it is. Like, if you look at my recent Facebook page, we've been working with this dog for almost a year. And like, we've seen him for things, illnesses, and he's had vet visits in between and stuff, but we haven't been able to draw blood on him because he's been very sensitive about his feet. And now Maddie drew blood, one of my techs drew blood and trimmed his nails on a dog that previously had to be completely unconscious in the vet office.
That's awesome.
So
That's awesome.
To see what we're doing really pays off. Is great. And not to mention, we don't get bit as much. Hurting us as much. We're not throwing out our backs wrestling dogs. And we don't have to worry about clients being like, oh, my dog got pinned down and had this awful thing. It's not anything that we do. And clients appreciate it too. A lot of the times we're like, all right, that was really stressful for them, even just coming in the building. So why don't we just like make today a happy visit, and we'll give you some meds and have you come back another day. And people are pretty receptive to that too. And I think gradually a lot of people are starting to become more receptive and acknowledging that it does really help. So it's been super gratifying to see that process for sure.
Well, and part of me wanting to get you two together to do this is because I think that a lot of pet parents don't know that they can teach all their dogs this stuff and do it at home and then go to their vets and advocate for their dogs and that kind of thing and work with their vets as a team. I think sometimes there's a line where, people think, no, the vet thinks they know everything, so I'm not going to go, or, or vet, or a tech comes across really strong, but they're not meaning to because they understand what the dog needs in the moment, but they're not educating the human. So I think it's really great for us to reach out to those pet parents and professionals so that they can understand there's good ways to advocate, good ways to work together to kind of blend that line that's been put kind of, I think, in the world. And that's why I wanted to bring you guys together, is because of those reasons that you guys mentioned. So I so appreciate it so much. Will, it was the class.
I'm going to put a couple comments up too. Louise said Piper was awful at the vet at the beginning. She actually bit the vet very early on in her relationship, and it was so scary. Yeah, and that's, I've seen how Piper is now, and she just she handles things much better from what I've seen. So, and it takes time. And I think for me, one of the biggest things is not having the goal of like at your next appointment, your dog is going to be in full cooperation.
Yes.
And, having that expectation, because if we set that expectation bar up here for that, then, it's going to feel like you're never going to get there. And if you're not there, then why even bother doing any of it? Right. You kind of get stuck in that cycle. So for me, it's more about like, can we just get them a little bit less stressed about it each time? And if we can get further than that, so they're much less stressed, great. But can the goal be to just have maybe a plan and a way to advocate and all that stuff, that management of it? And then also a way to communicate with your dog and let them know what's coming. So we're going to be doing a lot of that at the workshop, is talking about that from my perspective anyways. And, let them know what to expect. And that's huge. And it doesn't mean that they're ready to fully cooperate in it, but at least they know what's coming so they can kind of let their guard down at the time when you're not saying like, okay, I'm going to put my hand on you now or whatever it is. They can be like, okay, you're going to let me know before you do something. Great. I can like take a breath in between and I can go lick the licky mat or whatever. And I don't have to feel like it's a trick, because I think I see that a lot at the vet's office, is that, even when we try to give cheese or peanut butter or those really high value treats, it's done sometimes in a way where, the intention is good from the technician or from the vet of like, well, I'm trying to make this happier for them. But then, you give them some and then you grab them, or you give them some and then you do the vaccine right away. So all of a sudden now this really high value reward has been poisoned basically. And they're like, oh no, that's that tricky cheese. That cheese that always leads to this really scary thing. And there are better ways that we can approach that so that it doesn't turn into that sort of situation. So either it can be reversed, like the timing can be better, or you can build up to that, or you can have lots of other opportunities for just like no trick cheese, just treats, no tricks. And, so there are better ways to go about this. And if we can, again, just do a little bit better each time to help our dogs feel a little bit better each time, that's always my goal. And that wasn't my goal for a while. For me, even with Willow and with some of my clients' dogs, I was like, okay, I think we can get to this level before the vet visit. But then, you don't live at the vet's office. So like the context is so different that it's really hard to fully prepare for that unless you're really going out of your way to go there on a regular basis. I know they've compared cooperative care in dogs and cats to like cooperative care for zoo animals a lot. And they're like, if the zoo animals can do it, then the dogs and cats, it should be no problem. Why can't we teach that to our dogs and cats? I'm like, well, our dogs and cats don't live at the vet. Like it's very different. And, there's a lot more to it also. We don't raise them the same way. We're not quite as proactive. We kind of do it as we need to, that sort of stuff. So there's obviously a lot more that goes into that. But I do think that is one huge barrier to it, is that the zoo animals, unfortunately, live at the zoo. So they have all this opportunity there in their own context. I see a lot of dogs do do much better when, you know, the vet can come to the home, but again, that's not always practical either. So, so there are a lot of barriers. So I think if we can just like get over one barrier at a time, then we're making progress.
I love that. I love that.
Let me put up another couple of comments just so we don't miss there. I got stuck on Louise's there, but I'm sure a lot of these are similar. Yes, Stella's teeth are nasty, but I have felt the same way as Laura, but she has a dentistry scheduled with Dr. Shannon next month. Fingers crossed that we both get through the day with minimal stress. Yes. Johnny, you'll be at the workshop, so we'll get to give you all the tips.
Yes.
Gonna do great.
Yes. And Louise, what an amazing story. Yeah, I think Shannon, she had said that right after the story you just told. I just wish everyone understood that it's a long game to help dogs feel better. Yeah, and that's huge.
And I think something to also add to Louise's comment is a team. I always tell all my students, like, you need a team. You need a team that's going to support your dog. You have a medical team, and you have maybe a therapy team, and you have friends, you have family, and a support system. Your dog needs the same thing. And so, you know, trying to support them as they work with the team is super huge too. So,
yeah, I think that's going to be, like, honestly, what I want people to take away from this workshop the most is how important working with everybody is. So like the pet parent is going to have their role, the trainer is going to have their role, and then their veterinarian's going to have their role too. I can't tell you how many times people have come in and they're finally asking, you know, like, annual exam, how's your dog? Oh, they're fine. And we're like, okay, any coughing, sneezing, all of that? No, they're good. And we've recently started being like, what about behavior? Because otherwise it doesn't usually get brought up at exams, and people don't think to include their veterinarians in that conversation. And it's important. It's super important because there's so many things that we can do, or maybe there's an underlying medical cause that needs to be addressed that's contributing to behavior, especially like, you know, a dog's getting older and just now is starting to bite at the kids. Like maybe it hurts, or, you know, the dog was totally fine for a long time, and all of a sudden they've had this recent shift, like they have a vision problem or something, you know, something that could come up so quickly. So talking with the vet, and then the role in veterinary behavior medications too, which I know is sometimes hard for a lot of people to think about because there's still a huge stigma about human mental health. So then that translates into animal mental health, and you know, I don't want them doped up all the time and all of that. And I always tell people, this is Prozac right here. I'm not comatose in a corner. It's what I take to get through my day to day. And everyone goes, not everyone, a lot of people go, oh yeah, I'm on Xanax or, you know, whatever it is. And then we're like, yeah, see, like also our dogs can have anxiety too. So it's kind of important to put that relation. But yeah, so many people get to me and they're like, I've tried everything. Like we went to a Petco puppy class and I tried some CBD and nothing has worked and he's just getting worse. And I'm like, okay, we have not even scratched the surface of everything. Like, let's go. So, and then the role too, I always tell people, I'm like, I can medicate a dog all day, but if we're not working with the trainer to change the behaviors at home and to, you know, develop better coping mechanisms at home, we're not going to see these behaviors improve over time. And if you're not doing the training at home, following up with the plan, and I'm guilty of this, I know we're all busy too, you know, sometimes things get out of control, but we have to all work as a team together.
Well, and I think where we are so busy, our teams are really good at following up, like in different places. Because like I work with Shannon on a few dogs and we'll check in every now and then. Hey, have you heard from this one? I haven't heard from this one. You want to send an email? I'll check in. And so we're able to stay on top of them and just be there to support them through it all too, which I think is great. So it is a long haul. We want to make sure everyone knows that we're there for it with you. So yeah. All right.
There's a couple more little comments.
Oh,
sorry, Shannon,
awesome.
Covering you up here.
I love it.
Emma is a German Shepherd rescue. I was able to cut her nails for a good year and a half with no trouble. Then this last July, when I went to cut her nails, she yelped like I stabbed her when I got to the third nail on the second paw. I thought I must have gotten it quick, but no, the nail was fine. So I assume that particular toe must have been tender for whatever reason. But since she won't let me cut her nails, even at the vet with 3 of us, nope, she will actually go into, I think she hit, let me go to the second one. I'm not sure, but the vet and techs loved her. She is perfect doing anything else. Blood draw exam, ears, nail, mouth, but those nails, and how can I take a year and try to get her nails shortened? That'd take way too long. Yeah, I think that's a big question. And that that's sort of what I was referring to before when I mentioned, like, what do you do in the meantime? When you need to get the nails cut because they will keep growing, but they're not ready for that full cooperation. So I think there is a lot that you can do. I know I personally, you guys notice my light shut off. It's like one of those automatic things. I always left my office light on every time. So my husband's like, I'm going to get you one of the automatic ones where it like shuts off at a certain time. So that's what happened. So I'm partially in the dark here. I'm like lit up. I'll turn it on in a sec. Anyways, yeah, I think there's a lot you can do. I use a scratch board a lot in between sessions too. So the dog is basically like pawing at essentially a nail file. It's like sandpaper, 80 grit sandpaper. So they're filing their own nails a bit. And I also use like a licky mat on the fridge that Willow's licking while I'm doing some nails. And sometimes I can only get 1 nail done per day, and that's okay. So if we did 1 nail a day, for depending on how many dew claws they have, so for however many days that ends up being, we'll go with 20, we'll make it easy. And, then you're making decent progress. So, and then maybe sometimes your dog will let you do more than 1 nail a day. So I think there are quite a few techniques out there that can help with that. And, but I do think that's a very common question that comes up too. And whether it's nails or whether it's something else that my dog's not ready to cooperate in it, but it needs to be done for their health, for health purposes.
Yeah. And that's where too, like, talking with your veterinarian, if it's a specific foot, all of a sudden she's never had an issue. Like, is there pain in that foot? Is there arthritis or something like that? Or is it an anxiety? Has she kind of learned like, oh God, the nail clippers come out, this is scary. So we need to address the anxiety for her with some pre-appointment medications. So definitely something kind of involve the whole team, but training, counter conditioning to nail trimming can be super helpful. And it might not take your dog a year. Most dogs, I'd say probably a couple of months of happy visits and really working. This dog was one that had just been severely fear reactive for a few years and had only negative veterinary interactions. And it took a long time to overcome that. So that's definitely not the norm, but it can happen. And I don't like to put a limit on any dog's progress. And that's where coming up with alternatives in the meantime, whether that's scratch boards or, like Laura said, trimming 1 nail at a time. Sometimes if it like really needs to be done and the dog tolerates injections, well, we'll do injectable sedation and just kind of like get it done. And then it's done in a way that's not traumatic for the dog. They just kind of wake up and they're groggy, but it's not stressful for them. So working, with the whole team on those types of cases is important.
Yeah, I had a client's dog, a rescue, and her nails were just crazy long. I mean, they just were practically curling around. She was an older dog. She was probably like 10 or so. And the first time I had met her, you could just see how uncomfortable she was just walking. And the client knew this already. And but she hated having her feet touch. But it needed to be done, so. The vet that she was going to, which was much further away at the time, she had just moved. The original vet she was going to said, well, we'll just get multiple people and we'll just hold her down and we'll get it done. And luckily this client had enough sense to say like, that doesn't really feel right to me, especially with I shouldn't say especially, but like an older dog. I mean, that's going to be painful to be held down, never mind traumatic. So when she switched vets, I talked to that vet. And they sedated her, did just full sedation because she was fine with vaccines. And even if she wasn't, that ends up being less traumatic. And I know from experience, because Willa just had her full sedation, did everything we possibly could do to get everything checked all at the same time. Because I also had pet insurance. So I was like, you know what, let's just get it all done right now while she's sedated, right? It wasn't so bad. But anyway, so this client got the nails trimmed back to a reasonable place. The quicks were still kind of long, but now she can move forward from a better spot, you know, and she can start working on this stuff from a better spot, because we didn't have time to wait for her quicks to recede enough to be able to cut them at all. And we didn't want to traumatize her either. So yeah, that was a good example of that.
That's awesome. Well, that kind of leads me into, I wanted you guys to both kind of briefly share a little bit about your workshops and what you're hoping that anyone that attends is going to walk away with from the workshop. Because I think I'm so excited about it, and I know stuff, but some of the stuff that you guys already shared with me, going through the death and loss that I've gone through, there's some topics where I'm like, oh, I wish I knew more information on this so I could have better set myself up or my dog up. So I've learned a lot. And I'm excited to learn more. So do you want to share with everyone else so they can hopefully get just like excited as me? I love to dog nerd it out, so I'm always excited, but it'd be really neat for them to hear what they should be excited about, because I've already heard a whole bunch of it. So
Shannon, you want to go first? Because I know you have two separate ones.
Yes. So I'm touching on two separate topics. One is going to be more towards preparing for the appointment. So talking about the role of how you can make vet visits less stressful for your pets, and how vets can make your vet visits less stressful for your pets. So whether that's training or behavioral medications to reduce anxiety. I'm going to talk about happy visits and what we do at our clinic, and how we work through some of the more difficult cases that are harder to handle in a veterinary setting. So that's going to be the focus of one lecture. And then my second lecture is going to be the importance of including your veterinarian in patient behavior. So going through some cases, some with medical conditions, some with strictly behavioral conditions, you know, what we did, what worked, what didn't work, and kind of how we got to a much happier dog in the end due to the interventions of both behavior trainer and veterinarian. So really want to emphasize like why it's important to talk to your veterinarian about your pet's behavior.
And then what are you hoping that pet parent, a veterinarian or other pet professionals might take from your workshop? Because obviously they're coming from, I guess, 3 different backgrounds. So like, what is something that if they're watching right now, like what would they get from it? If you want to just kind of dabble a little bit.
I definitely want to show people not like the way, but a way to incorporate behavior into veterinary practices or into training practices. It's such a good skill for our dogs to have. You know, we focus so much on training of tricks and nose work and, you know, those types of things. But how many people actually sit down and train their dogs for vet visits? And vet visits in themselves can be traumatic, you know, like especially they get porcupine quilled or they have a laceration or something, they need medical care quickly. And if we have a solid baseline for how they do with veterinary handling, you know, how much it can be more helpful. And I want to emphasize the benefits of like to the pet owner being less anxious, you know, having kind of a solid basis. And then to the veterinary staff, like the less kind of stress that it puts on us. So kind of show everybody from all realms of pet guardianship that we can make a really big difference in how animals experience the veterinary office.
Love it. Love it. Now, Laura, do you want to do the same thing? Share your thoughts.
Yeah, so I'm going to use my cheat sheet over here on my other screen to tell you guys what I'm covering, just because I have changed it a couple times based on feedback I've gotten in some of the groups and all that, and questions that have come up. I just want to make sure that I'm covering some of the more common things. So definitely ways to proactively prepare dogs for their appointments. So stuff that you can be working on at home or that you can have your clients work on at home. And I'm going to have a little sort of a cheat sheet of its own to go along with that. So you guys kind of have like a stuff to focus on, because I find that when I work with my clients, if they can kind of have not just like a checklist, but some sort of a list to just sort of frame what they really need to focus on, and then you can pick and choose what you and your individual dog would benefit from, or what your clients would benefit from. Ways to communicate with the dog during the appointment to lower stress. So in the moment, right then and there, like what could you be saying to your pet, your dog, or your cat? We haven't really focused on cats, but a lot of these skills can certainly be used with cats too. So ways to communicate in the moment. Why giving them cheese, like I was saying before, giving it cheese and just calling it lower stress often isn't actually the case. How you know, that might be done either in the wrong order, or that you might need to build up a little bit of trust first, stuff like that. And then how to communicate with your dog's team or clients to create a plan. So I'll also be hitting on that sort of from the trainer perspective, from the behavior consultant perspective, what I've seen to be helpful. What to do if dogs can't or won't eat. So a lot of times dogs aren't ready to eat in the vet's office. And here we are saying like, okay, well, let's load them with treats to make it really happy. Well, what if your dog is already at that way too stressed level to eat, or they're going to be sedated, so they can't eat. So you can't actually give them any food or any treats. You know, what are some other things that you could do to help them prior to sedation? What else? I think, Shannon, you were going to talk about this a lot, but I did have on my list also, you know, when to consider sedation and why. So I just was going to talk a little bit about a couple different stories that I have about that. And then demo of cooperative care techniques to practice at home. So we'll be doing that for a little while. Plenty of time for open Q&A. And then I think just, you know, like why, I also want to look at in the beginning, you know, why even do any of this? Like, could you just get through the vet appointment and then like hope that your dog or your cat stays healthy and there are no real emergencies? And, you know, like what are the real reasons for doing this? And then of course, I also want to stress that like one iteration at a time, like, let's just take those one step forward and let's just see how far we can get with that. And then, you know, another big thing, apparently my cheat sheet list was changed, but another big thing, because here I am thinking of things that weren't on the list. Another big thing is, I'm not going to cover a ton of body language because I think most of the people coming already have some idea of body language, and there are tons of videos out there that you can watch on, you know, what body language looks like. But there are certain things that we see very regularly from stressed out pets in veterinary or handling setting, like at the groomer. Things that might make you say like, oh, he's fine, like he's much better. He's no longer fighting, you know, so he's just kind of laying there, or he's frozen, so, you know, we can get through it. There's a lot that the dogs are saying in those moments that are often misunderstood by both professionals and pet parents. So I just want to make sure that we're all sort of on the same page there, and that you can see some of the non-behavior as behavior, right? So the lack of doing is doing. So the freezing up and stuff like that. So, so we're going to talk definitely about that. I've got some video clips that I found to showcase some of that. I think that pretty much covers it, but chances are if you guys are continuing to ask questions, there's going to be a little bit more in there too. So, and then like I said, we'll have the open Q&A at the end, so you guys will have plenty of time to ask open questions too. Yeah.
Well, and I want to capitalize too where you said, you know, it's about not just about if you have a problem now. You didn't say it just that way, but I'm guessing, or from my understanding, it's also about setting them up for if they don't like the puppies and that kind of thing. And you know, I had a naughty dog, and had to do a lot of work with her. So it's, you know, like you said, second generation, you learn from your first dog to your second to your third. And so now I've worked my guys so well that they can lay down and they can have blood drawn. They can, like, Aiden was just at the vet's, what was it, back in October. And they're like, oh, it was a new vet that we were at. And they were like, oh, you know, how is he going to be for a jugular dry? So, oh, he'll be fine. They're like, you sure? I'm like, yeah, he'll be fine. I told him to down on his mat. And then I went over and I just kind of lightly rubbed his chin. And then the tech held his face. Boop, went in, done, no problem. And he was like, oh, cool, where's my cookie? Like, so, and those of you that know Aiden, he is psychotic otherwise. So he's a jumping jelly bean. I don't even know what it is. Mexican bean. He just jumps everywhere. I also want people that are watching to know that you should come if you want to learn how to make them better in the beginning. Like if you've got puppies or you're a breeder who has puppies and wants to start them off right. Like I'm a breeder and it's huge. Like we do happy visits with our puppies at the vets, and we practice going up and down the scale with the puppies while I have them. So I think it's super important to it's not just for the problem now. It's also, you guys are going to teach a lot of people things about, okay, what do we do so that we can be proactive before those problems happen? So they could get, hopefully, like a jugular blood draw like Aiden is able to do. So, and he literally sat there for everything. The shots, boop, they poked him. He didn't even care. He's like, oh, you got chicken? Sweet. So I think it's also important to understand that it's not just about the problem now. It's also about being proactive later too. And you guys are going to capitalize on that too. So.
Yep. And I think also from the vet professionals or the groomers or any of the pet pro from that side of things, those who, have the patients and have the clients who come in, especially a veterinary practice, probably also the groomers, but there's a lot of time constraints and it's a very high pressure sort of environment, right? Like there's a lot going on typically at the same time, especially these days, I'd imagine. I mean, it's been about a year and a half now since I've been in the vet practice, but it was very high pressure. And even as I watch back on some videos and stuff like that, you can see the stress on everybody's face just in trying to okay, this dog just keeps moving away from me. I just need him to come over here so I can give him one quick vaccine. So then I can move on to the patient who's sick over there and go do this. It's like it's hard. So I think, again, I want to stress for me what I'd like the pet pros to get out of this is that it's not about okay, we're going to take all this extra time and we're going to do all these extra things. That would be great. If you can get there, I think that's awesome. That's an extra bonus to add. But there are little things that you can change in the office or just little tweaks that you can do so you can do things a little bit differently. And these don't have to be big, huge, massive changes to have a big effect on any of the patients or clients that are coming in. So I definitely have lots of ideas for that too, but again, one step at a time. So I don't want you to be okay, well, all right, I went to this workshop, now I have all these things, I got to make all these changes.
Yeah.
Oh, this is just another thing to add to the list of all the things to do. It's no, just pick one thing, change that. And then once that feels good and you're okay, I feel like I can do one more thing, then you can add one more thing in there. So that's definitely one thing that I want the pet professionals to take from this. And then also, of course, the clients and their dogs as pet parents, those little things you can be doing along the way too. So, yeah.
Yeah. And, and the whole point of this is that we all came together on this was we felt that we all want to work together. We all us pet professionals, we all want to work together and we all want to make, everything as easy as possible for everyone involved in your dog's team or your pet's team in general. And so we figured we'll just pick and choose some things that you guys have already done and tried and it's worked and be able to share that knowledge with others. And that's why we feel it's so important because we're all here together. We're all here to make it easier and less stressful. So if you guys have some tips that are helpful, then we might as well share them. And that's why this workshop is kind of came together really. So do you guys have anything else to add? Anyone get any comments? I say post your questions now. I'd say if we got some questions or comments, post them now. Do you guys have anything to add while Laura kind of digs up that comment thing?
Let's see. This might bring up some stuff. Danielle said, Jack was taken out back for treatment for his physical and did well until someone walked by and dropped a piece of paper, total meltdown and shut down. This year, I asked to have him stay in the exam room with him, and they agreed. I think there will be less stress for him to watch out and less unintentional triggering. Yeah, and I think in knowing Jack, I think a big thing that we tend to see from the professional side of things, or at least from the trainer side, and I know Shannon, you recognize this regularly, is the difference between he seems to be doing fine, he seems good, and then one thing happens and he just explodes, right? And that typically will tell us right there that he was never fine. He was very close to his threshold point, and he was just holding it together emotionally and tolerating it. So we're going to talk in the workshop I'm going to talk in the workshop at least a lot about the difference between tolerance and comfort. Like a dog who's actually comfortable and pretty relaxed at the vet, versus a dog who's just like, okay, I'm going to just, it's cool. Like, I'll just take in all the things. I'll take some treats from you. And that's cool. I mean, Willow will take treats all day long. Like she'll take them hard. She'll take them fast when she's feeling like really amped up and intense, but she'll keep eating. She's like one of those stress eaters, right? That people who will eat ice cream when they're feeling really stressed out. Ask me how I know that. Yeah, so it's just, some dogs will shut down and they won't eat, and that can be a good first indicator that they're uncomfortable. But some dogs will eat through stress, and that doesn't necessarily mean that they are comfortable. So, so I think definitely looking at that. But that is, Danielle, a great example of, I think he probably was just holding it together, using some coping mechanisms of like, okay, I'm just going to go say hi to the people, or I'm just going to eat the food, or I'm just going to, but that was probably how he was feeling, like, okay, I'm just going to deal with the stuff. And then that one extra thing happened and bam, like just, over his threshold at that point.
Yeah, that's what I was going to say too, is that he probably wasn't doing well. I hear that a lot from other clinics, and I'm, because then I'm like, all right, well, if he does better away from you, I'll try it. And a lot of times what happens is the dog completely like freezes out back and just shuts down, and I bring them back to the owner and say, nope, he's not fine. So let's try it with you. There are some cases where the dog absolutely does better from the owner. I see it really commonly in breeds meant for protection, German Shepherds. You cannot get near the owner with the dog. And that's kind of a whole different thing. But part of what I'm going to talk about at the workshop is exactly what you did, advocating for your pet. So if you recognize, especially, I had a client who came to me for a new behavior consult recently, and she was like, okay, this is his little canine climb. We're going to get him up here. He's stationed. We do that. I'm like, you tell me what works for him, because you know your dog, and let's work together on this. So having that communication with the veterinary staff of being like, he does better for his back legs rather than his front legs, or he's really sensitive about touching his back or his ears, and he's better if you do it this way. That type of communication, A, is ridiculously helpful to us, and B, it makes you more comfortable, and C, makes your pet more comfortable. So that will be part of what I'm talking about, is how to communicate with the veterinary staff about those types of things.
Love it.
Yeah, and I think that's huge. And I think during COVID, obviously there was curbside, so there was very limited choices there. Like sometimes we could go out to the car, but for the most part, the pet had to be brought into the building without their people. And for some dogs, those were their early experiences at the vet's office. And for some, it was like, they had been going to the vet with their people for a few years, and now this was different. So like, I think that added a whole complicated layer to things for sure. But I definitely find that dogs do much better with their people, because they actually have somebody familiar, somebody they're comfortable with. But like Shannon said, there are some exceptions to that, but there are far fewer exceptions than most people realize. Typically the dog who's, acting up and they're growling and they're doing all this stuff in the room when their owner's there, and then you take them out of the room to, the treatment area, or you ask the client to leave the room, whichever way you do it. And then the dog's like, ooh, yeah, I'm not going to take this on anymore. Yeah, I'm too scared. I'm too scared to growl at you and to actually like try to put up a fight. So I'm just going to tolerate it. That's a dog who's more shut down now that you're out of the room. And it's not because they feel better. It's typically because they actually feel worse. But they're quieter. Their body's quieter. They're not moving as much. So it makes us, from the professional side, makes it easier because we can get some of that stuff done. But is it actually better for them? No, not necessarily. Sometimes, I will say, it, like, if there is an emergency sort of situation and you have very limited options, okay, there's a possibility that, like, okay, we are going to have you leave the room so that we can do this without. But if you have to hold them down at that point, that's not. And I can go on a whole. I'll just keep going. I'll take you guys till 10 o'clock. Like so many things. I get very passionate about it. Yes.
Awesome. Did you have any other more questions or comments down there?
And June, I think, just following up to the nail stuff. Thank you for all the advice. We tried the lick mat. She still wouldn't let us. So yeah, it might be June that the lick mat, she might just need some nice positive experience with it first so she can trust the lick mat. The lick mat's just for fun. It's just like my after dinner treat, no big deal. And then down the line, you'll be able to use it potentially for nail trims, but there are ways that you can do that to sort of speed that up a little bit so that you can create a pattern out of it so that she can trust that, the nail trim, it can all become part of the pattern. So it's a little complicated to get into right now, but that's definitely something I would talk about at the workshop. So if it's something that you want to learn about, I would highly recommend coming to that. Then you had said, I bought the scratch board, but haven't started it yet. Tried pills prior to an appointment, but it was like I'd given her nothing. I like the injection. That sounds good. Yeah. And I think, Shannon, you could probably speak to this, but I know like with Willow, the first few times I gave her meds, I think the adrenaline was so high. She was still nervous enough. Did not take effect at all. So we upped them, still didn't really like have a huge effect. But then a couple visits later, I mean, like Shannon, I brought her into you and it looked like she was like walking sideways slightly. I'm like, I swear I gave her the same amount that I gave her last time. So now we've lowered the meds again, and she's gotten so she's not doing sideways walking anymore. But it's you. But so we had to go up a little bit, then we went down. But I think it's because she's gotten more comfortable too. So her adrenaline and her stress level hasn't been up so high.
That's such a good point. Such a good point. Yeah. People don't think about that. They don't think about that when they do it, because of how the animal is. That's a good point.
Yep.
Yeah. And it does take some time to find what's going to work for a certain dog, whether that's getting a higher dose or giving meds the night before and the morning of, or adding in additional sedation. There's so many options, which I'm not going to go like crazy into at the workshop because we could spend hours on just pharmacology of pre-appointment sedation. So we won't do that. But definitely there are other things to try. Probably even scratch the surface. So there's lots of different options. I would not give up hope, but I think definitely finding a med combination that does help reduce anxiety is really important because it's going to be helpful to teach her. She doesn't need to be anxious about it. And then like what would happen with Willow, like as she learned, because when they're way up here, they're so anxious, they're not learning, they're in fight or flight, they're saying, get me the heck out of here. But if we can bring them down to a point where their anxiety is much less and they can be like, oh, I'm not going to actually die when my toes are trimmed, then we can start to gradually reduce the medications. Sometimes not completely, but sometimes completely, as they've learned, as we've taught them cooperative care, laid that good foundation for training. It's not something necessarily they're going to need for forever, but it's usually extremely important in the meantime to help with making training effective.
So Bonnie said, I'm excited for the workshop, especially after this live chat. Thank you to all of you. Yes, Bonnie, we're excited to have you there. And then she also said, finding a care team that's willing to listen when you try to advocate for them is amazing. Yeah, and I think that's a huge part of it too. Is just finding that right team, whether it includes you and the vet, or you and the trainer in the vet, or you trainer the vet acupuncturist. That's essentially my team right now. And then obviously there can be many other professionals besides that too, but I think having a team that does support you and support your needs is important, and it's okay to keep looking for that. You don't have to stick with the vet that you have, but it also, before you just change vets, might be worth reaching out to them and talking to them and communicating with them, because it goes both ways too. They're doing the best they can, you're doing the best you can, but maybe your best is just, it's like you keep missing each other somehow, and if we could just kind of connect. So I always think it's worth reaching out, even if you think that maybe it's not the right team for you. So
yeah, I think too, the more that we as veterinary professionals hear that it's important to people, we'll hopefully start to get more veterinary professionals on board that like this is something that matters to people and something that I should look more into and learn more about and start practicing. And then hopefully once they see that it does really help and make a huge difference, will be something that's put into practice even further. So that would be a dream that everyone everywhere does this type of stuff, and we can all have a lot happier everybody.
I think, you know, where I worked, we would get, you know, we would try to promote all these fear-free practices and all these cooperative care type things. And we would recommend the meds, and we would recommend, you know, coming back, and this is too stressful for your dog right now. And like, so let's break this up. Your dog doesn't need this thing right now. So we're also going to be talking about needs versus wants and how to sort of decipher between those during the workshop. And we would get pushback from the clients too. So after a while, I could see where it would, I was only there part-time, so I didn't get it all the time, but I could see after a while where it'd be like, okay, well, I've got all these clients pushing back. And, you know, I think what they say for like if you're complimenting somebody versus kind of giving them a negative versus a positive, basically, they'll hear like 7 negatives for that one positive. So that's kind of what that brings me back to. There's like, you've got maybe 7 clients who say, no, I don't, you know, I'm not interested in that. I just want you to get it done. And that sticks out to you more than that one client who's like, oh yeah, no, I appreciate that you recognize that, and I would be happy to come back next time. So like, you remember those harder clients, the ones who push back a little bit more than you remember the ones who are open to it sometimes. So if we can get more people who are open to it, I think that's huge. But also knowing that you as the pet parent, like being open to it matters a lot to the pet professionals too. And we need to hear more of that. So having that communication, I feel, is really important there. So.
Yeah, and that was one of my goals of bringing this together is we're all big on education, and, you know, a lot of the stuff is hard for pet parents and professionals sometimes to reach because they're in different states, or they're, you know, with my Mike Shikashi workshop, that's what I heard from a lot of trainers, like, oh, everything's so far and I can't leave. I'm the only one that runs my business or whatever. So I think it's a good way for us to start that, you know, locally, and just let people know, hey, like, here's where the vets are coming from. Here where the techs are coming from. They're trying to do their best. If they tell you this, you know, this is why, and educating the pet parent so that the vets can also get a little bit of backing as well, and the vet tech. So I think that's important to capitalize on. It's all about educating everyone. I think there's so much knowledge out there now as far as mental health for dogs and that kind of thing. And I think that there's not a lot of platforms that are able to push it to the general public. So I'm excited for you guys to kind of spearhead that here, because I think that's so important for everyone, professionals and pet people. So I appreciate you guys taking your time to do this, and I'm hoping that we'll get more people to sign up too. So we have a good group, but we want to spread as much word and education as we possibly can, and that's our goal for sure. So
yes,
yeah, awesome.
Come see us next weekend, not this week, the 29th.
Yeah,
9 to 2.
Don't come this.
Yeah, we were going to do it on Saturday, but then I heard from another vet. She reminded me that a lot of veterinarians work on Saturdays. So I was like, oh, so we'll do it on Sunday. But then I'm like, well, maybe a lot of vets won't use that as their day off. But like, no, come hang out with us. We'll be super fun, and we'll have lunch.
Yes, we'll have lunch. Yes. And I'm going to post out there. This will also be, we're working on getting CEUs through CPDT as well. We haven't been approved yet, but we are kind of in the waiting period. So hopefully that'll come through as well for all you dog trainers that need that. So yeah, but I'm excited to have you ladies. You have no idea. It's like, I'm super excited to hear the topic and hear all the information you have. And so yes. Woo, sweet. I love that.
Alina, I think that would be awesome, because Alina works with a lot of foster dogs too, for cattle dog rescue. And I love working with fosters and people who, you know, work with rescue, or of course, pet professionals like groomers, vet techs and stuff like that, because then they can get the word out to more, they can help more dogs and help more people. So it's a nice way to spread some of this knowledge even further too. So I do love that. So Alina, I think that's awesome. And then just said, love these points. In a vet appointment, the vets only have so much time to cover medical needs and comfort. Yep. I love when professionals support professionals and help spread the word for the comfort of animals. Yes, Jess, that's awesome.
She's got one of my crazy labs, so she understands.
Yes, I thought I recognized the name. Yeah.
Yes. Yes.
Carrie said, I wish I joined the chat earlier. Thank you. Scotty is learning. Yes, definitely. You can watch the replay. The replay will be posted on all of our pages. So, so you can get
I'll put the registration too in the comments. Like I'll put the registration link in the comments after we get off. So then it'll be right underneath the video. So,
yep. Sounds perfect.
Yeah.
Yeah. Awesome. I'm excited.
Me too. Willow was too, with all the bed shaking.
Willow's so excited.
Willow's so excited. You guys are going to see, if you come to the workshop, you're going to see a lot of Willow in videos because we've been working really hard. We go to Shannon's for happy visits, and we work with her awesome technician. And so, yeah, we've prepped some videos in advance because Willow won't be there live. I'm sure she would love to be, but I've decided that's ultimately not going to be good for her to be the demo dog, but we will have a live demo dog there. And we'll be able to show off some of that stuff. But then what I would love to have you guys do is be able to bring this stuff home and work on this with your dogs and just, kind of keep in touch. And we may have some stuff in the works for that too coming up, but we're not going to disclose that just yet because it's still in here. I don't even know if I told Megan and Shannon my ideas yet, but I do have some ideas for that for, further help for you guys if you need it. But yeah, I think just taking some of this stuff home and being able to work on it, I think is going to be huge for you guys and your pets, your clients' pets. And Willow will happily demo through video.
I love it. All right. Well, thank you, ladies, for joining me. I am so excited. If you watch this, we got another comment. Look at that. They're all popping in now.
I didn't even mean to click on it, but I did. I'd love to hear some final thoughts related to why some vet practices are go. I had a very poor experience with one where I received pushback when I was inexperienced in training and advocating for your dog. I assume you mean, yes, dog.
I'll take this one. Also, my computer might die in a minute, so if I just disappear, I'm so sorry. Veterinary profession as a whole. So when I'm not working as a vet, I volunteer with Not One More Vet, which is a veterinary suicide prevention organization. The veterinary industry is burnt right now, just like a lot of industries, a lot of understaffing. We don't have enough time in the day, and COVID saw a 30% increase in pet ownership, but we did not see a 30% increase in veterinary professionals. In fact, we saw a decrease in veterinary professionals. So a lot of times it's literally just trying to get through the day. And I totally empathize. I see that every day with my colleagues struggling. And I am a solo practitioner right now. I stopped taking new clients, which I hate. I see new behavior clients, but I just can't keep taking more GP for myself and still be able to make sure I'm taking care of my patients adequately. And a lot of veterinary clinics are at that. The lack of willingness to talk about behavior, I can't really talk to that because obviously it's something I care a lot about and want to talk about. But the go, sometimes it's literally just trying to survive the day. So I'll put that spin on there. But notonemorevet.org and nomv.org has a lot of information on how pet parents can be more educated in that too. So
awesome. I love it. Any more comments? I don't want to miss anyone. So
well, they keep popping up. Hold on. Oh, boy, one more. Our practice is just coming out of the backlog. We stopped taking new clients as well. Yeah. Yep. Yeah. No, we're seeing that. I mean, the place I work, they're down to one vet now too. And yeah, it's getting pretty sparse up there.
Well, and again, another reason for this workshop is to bridge that communication and maybe some misunderstandings that are out there between those lines of pet parents and pet professionals. So, because I think there is a lot of misunderstanding, like everything else in the world. It's like, you guys don't know what I do day to day, or if I'm having a stressful day. And just like, I don't know if my vet's had a bad day and I'm coming in with a sick dog and I'm so stressed out. So I think it's really good to also kind of educate people on, those aspects too. And the reason for this workshop, to make things a little bit easier too. So yeah, awesome. All right. Well, I guess we're going to jump off, and maybe me and Laura will try to chat into some of those comments if we can through the chat box. And yeah, so sign up. I'll put the link below right after I get off here. And if you guys have any questions, feel free to comment them below this live. Share this live with anyone that you think would be interested, because we want as many people to come as possible, because we're all about educating. So get it out there. Get it out there. So we have a good group right now, but we want to reach hundreds of people if we can. So
Yes.
See you on the 29th, everybody.
Yes. See you next Sunday.
All right. All right. Thank you, ladies.
Right.
I appreciate it.
Bye, ladies.
All right. Bye.